Hello, how are you? Let's talk a little bit about postpartum and returning to activities or exercise. You know, we get this question often, like into the inbox, into the DMs. Hey, I'm 3 weeks, I'm 4 weeks, I'm 6 weeks, I'm 2 weeks. Can I do this? Can I do that? Can I start? Whatever. Let's back it up. What I want you to understand is that we need a whole culture shift. We need a paradigm shift around the birth, the motherhood transition here in America. We need to respect the postpartum period here in America. And right now, we do not. One of the biggest things that was like a light bulb moment for me was when I was learning about the lack of care and support for postpartum care and rehab in our country, was that there is nothing, no protocols, nothing set up in place for mothers, whether they have a vaginal birth or a, drug-free, medication-free vaginal birth with drugs, major abdominal surgery, being a cesarean. There's nothing. It's all the same. 6 weeks, okay, you're cleared for sex and exercise. What? And the light bulb moment for me was I blew out my ACL and I had complete reconstructive knee surgery, and I knew exactly what I was doing for prehab. Let's not even talk about that, but I knew exactly what I was doing a month prior to surgery because of my amazing surgeon and his team. And the most important thing, I knew exactly what I was doing after surgery. My knee was in one of those range of motion devices. I knew what I was doing 3 days after surgery. I knew what I was doing 3 weeks, 3 months, and then up to a year post-op. I knew, like, it was laid out for me. I knew what was going on. And when I was coming across, like, trying to study postpartum in our country, which is very hard to do because there's very little seminars and educational pieces, it just blew my mind that for something like a cesarean birth, which is a major abdominal surgery, there is no rehab in place. So, enter BirthFit. This is one of the reasons why I wrote the curriculum for the BirthFit Postpartum series. This is why all of the BirthFit online postpartum programs exist. Because we need to have a respect and an honoring around the postpartum period in our country. The entire first year postpartum needs to be treated like as a sacred event, just as birth needs to be treated as a sacred event. The whole first month needs to be a line in. 30 days, 4 weeks, that's got to be a line in. Your nervous system just went through this huge experience, positive, negative, all kinds of emotions, but it needs to integrate. It needs to come back down to earth, grounding, breathing, those kind of things. So before I move on, a lot of people talk about, or they want to know about, birth outcomes, like what's going to happen, what's going to be the outcome of birth. And frankly, birth is full of unknowns. We don't know. I've been to close to 100 births as a doula, been a part of many more births, and as part of people's birth team, as a chiropractor, as a coach, and as an educator, and every single birth experience is different. Birth is full of unknowns. It is all the unknowns, and the things that you want in your pockets, right, are your breath, sound, and movement, but also surrender and adaptability. Being able to take any fork in the road and basically absorb it, adapt, and evolve and move on. People always ask me about birth outcomes, and I'm going to give you a spectrum. On one end, neither end of the spectrum is bad or good. Bad and good does not exist. good, like we're talking about unmedicated vaginal birth on one end, and then on the other end, there's a cesarean birth, which is a surgery. Vaginal unmedicated birth is going to be a smoother, more efficient recovery in most instances as compared to a surgical procedure. Just kind of think about that. That should make a little bit of sense. And as we go across this spectrum, all the things introduced are going to influence healing and the healing timeline. So as we start to add in maybe some Western medicine or some Eastern medicine or whatever you want to call it, let's say, labor starts spontaneously and then we go to the hospital, we labor a little bit, and then we get an epidural. Epidural comes with risk and benefits, and everybody reacts differently to an epidural. So we don't know how your body is going to respond to an epidural. We don't know what the healing timeline looks like to that. Maybe labor is, maybe it's medically induced. And then it starts kind of that cascade of events that usually happens at the hospital. Then Pitocin, then an epidural, and so on. That's going to be a little bit more. That's going to need a little bit more of the healing timeline, and so on and so on. So just keep that in mind, that there's no good or bad. It is what it is, and something that, has no drugs, no kind of medical interference, and it's just that more natural state, the unmedicated state. That's going to be a more straightforward, efficient healing timeline than something that's been mixed with pharmaceuticals and or surgery. So keep that in mind, that none of this should be on the same healing timeline, aka 6 weeks, you're cleared for sex and exercise. Everybody shows up to their birth experience with a unique and different lens. Everybody has a unique and different experience at birth. So therefore, everybody needs a unique and different healing timeline. There's some guidelines in there, some parameters we can do. But for the most part, I want you to understand that all the birth outcomes kind of lay on this spectrum, and they all come with different healing timelines. And the best thing you can do right away is that 30 days lying in, to allow yourself to breathe, to ground, put some bare feet on the earth, bond with baby, bond with yourself again, hands on your womb, connect, get some breath circulating in that lower abdomen again, and just really come back to earth. Use that 30 days to integrate, to settle, to allow your nervous system to settle. I promise you, this time, there's a truck driving by. This time is not anything that you can get back. Use it, soak it all up, and just bond with yourself, bond with baby, connect with your new immediate family, and then worry about exercise later. Cool?